I'm excited to offer you Cellulaze, the first and only treatment approved to use a minimally invasive laser to actually treat the structural problems associated with cellulite. Cellulite is caused by factors outside of your control. There's this misconception that cellulite is associated with fat in the outer leg, but in reality, I have patients in my office that are very thin but still have a significant amount of cellulite. Cellulite is really a structural problem that is caused by three factors. The first being thin skin. The second factor, these little fibrous bands that attach the skin down to the muscle that actually pull the skin down in certain areas. And in between those fibrous bands are little tiny globules of fat that are poking up to the surface, causing the skin to dimple. So what makes Cellulaze different than other treatments of cellulite? In reality, those other treatments are very superficial, and what they're doing is they're just basically redistributing water, and eventually that's going to come back again and the dimpling is going to reoccur. With our new system Cellulaze, what we do is I have the patient standing up in front of me before the procedure is done. I use this grid pattern and it marks off 5 centimeter squares of the cellulite on the outer aspect of the leg. The green circles are really those little globules of fat that I'm going to melt that are stuck between those fibrous bands. Then you notice I use a red magic marker. The red magic marker lines off those little fibrous bands that are stuck down underneath the skin that I'm eventually going to snap during the procedure. It's a minimally invasive procedure that we can do in the office under a local anesthetic. What we're doing is we're using that laser to address those problems associated with the cellulite. First of all, the laser is going to melt those little tiny pockets of fat that are underneath the skin. After that, the laser is going to snap those fibrous bands. The fibrous bands will help to release the skin, pop it back up to the surface. Then we're going to use the laser to stimulate collagen. That helps to thicken the skin. Now we've actually addressed the 3 structural problems associated with cellulite. As you can see, this is a minimally invasive procedure. The procedure itself takes somewhere in the range of about an hour, and most people are able to return to work the next day. You need to wear a compression garment for a couple of weeks afterwards, sort of like a Spanx that you would wear after a liposuction procedure. So that laser that we've used underneath the skin to actually stimulate the collagen will thicken skin over time. And the interesting thing is that the results will continue to improve as time goes by. We're honored to be selected as one of the Canadian training centers for Cellulaze.